Hi guys, my name's Melissa Dionarn. I'm a certified athletic therapist, and today I'm going to try to enlighten you guys about what an athletic therapist does, because we're kind of awesome in our own way, and we do have a role in the sports medicine model, but not everyone recognizes or even know we exist. So that's why I'm here. Okay, so first thing is education. So it's not a diploma. You have to go to university. It is a 4-year university program. And when I took it, we had to go to class, go to our clinic placements, and go to field placements as well, all on the same day. So you could have a 12 to 14 hour day, and that's normal. Yeah, we're crazy, high functioning individuals, and we thrive on it. And so I'd like to think that you want someone to help you with your injuries who just wants to get you going and moving. So yeah, so back in the day when I did my program, we went between both campuses. So imagine being between both campuses for your lectures and labs, and then going to clinic placements in your free time, and then going to your field placements pretty much sometime in the afternoon, evening. And that was every day. And then the weekends, you basically were with your team. I was with one team where every second weekend we were out of the province. So yeah, it's pretty intense. And but we get quite the skill set. We learn a lot, because to be able to apply for the national exam, you have to have a university degree completed in athletic therapy, and also have collected 600 field hours and 600 clinic hours before you can attempt the national exam. And so when you do attempt the national exam, it's only twice a year, and you have to do all of it in basically kind of like 24 hours. It's really stressful. So yeah, so for the national exam, you have, so usually they do it on the Friday morning. You go in, it takes 4.5 hours, because there's a break in there to rest. Your brain's like, and, oh, backtrack. So it takes like 3 months, basically, if you're studying every day. So while you're working full-time to pay off your university debt, you still have to study for your national exam, which is super expensive, by the way, because, again, there is so much involved in it. And so you're working nonstop to pay for your bills, right? And then you have to study nonstop, because you have to study for the practical component and the written component, and that's a lot. It's very stressful. And so when you go to do your national exam, your written is thankfully multiple choice, but you have 4.5 hours and the half an hour break. But so this is all when I did this exam, and so when you finish the first component of your written exam, yeah, you don't get to see that component anymore. It's gone. That booklet is done. On to the next. So you better hope you did well. And they do test out the questions. It's very challenging, and it's probably one of the professions where you'll see like people going like this and moving and in your exam, and that's normal because I'm trying to figure out what the answer is, because yeah, you kind of have to. So that's on the Friday. You get to view the modalities the night before. So you come back hours later, and you're still stressed out because you're like, okay. So then the following day you do, well, if you're lucky, you get the following day. Otherwise, your stress level's like, because you have to wait until like the Sunday. So thankfully I got the Saturday. And so you don't know whether you have your field scenario first or your clinical. So for field, someone escorts you to the room, and you sit outside in the hallway just by yourself and twiddling your thumbs. And when they're ready for you, they send someone out of the door, grab you, and go and tell. This is all they tell you. Someone is down and needs your help, and that's it. And you get to decide which component of the scenario you got, because there's 5 scenarios for the field, and you don't know which component it is. So we have to be intense, because when you have to make that decision on whether something is life or death, if you like EMS, you have to activate all those things, or is it something that you can take care of right there on site? That's a lot of stress. And so, yeah, you're in a room being examined, and you have all these equipment and everything, and you don't know what the time limit is. And so for the emergency one, they will say, just to give you a hint, like you're kind of done, is that, you know, that EMS, the paramedics have arrived, and what do you have to say? And so the other thing is, we have to know, to be a certified athletic therapist, you also have to be a first responder. So I have my certification as an industrial first responder, because that's part of our of what we do. Because when you're working on the field with a team, you got to know how to take care of people when you know, something bad happens. That's a lot of stress and a lot of pressure, and you got to know what you're doing. So again, we're really underrated for what we do. So people have concussions at a venue, broken leg, all those things. We either assess or assess and splint. So that's tough. And okay, and so back to the field. Once you finish one piece, they take you back outside, and then you stand, you're like, okay, and then they bring you back in and go, someone's down and they need your help, and you're like, okay, yeah, yeah, time to puke. Anyways, thinking that in your head. Anyways, so then after you're done that, they take you back to the holding area and whatever, the area you're waiting in. And then you go and do your clinical, or vice versa. And so what's nerve-wracking about the clinical was, you're kind of stuck in the room. They don't kind of let you go. So you do your assessment, and for the first part, because it's, for the clinical, it's 3 components and 30 minutes. And so... yeah, so you're in there, and you better hope to gosh that you get the right differential diagnosis, because if you don't, they do tell you what it is. So then for the stage 1 rehab, you have to rehab for that injury, and then it's followed by the stage 2 rehab. So yeah, no stress, none. That's very intense. And then you gotta wait for like 2-3 months before you find out if you're certified. And a lot of people, it's actually really tough for them to pass on the first time, because it's that intense. So, general public, you are welcome, because not just anyone gets to be a certified athletic therapist. You gotta work your butt off to get it, okay? And so we have to keep up our designation with our first responder certificate. We have to renew that every year, every 2 years, depending on who you're with. And yeah, we keep active. So the other thing is, we work in the clinic, so that's just field. So crazy, intense, fun. We work in the clinic and do similar things to physio, but we are not a physiotherapist, so don't call us that. Also, don't call us trainers. I mean, come on, guys. Like, let's have some respect. I worked really hard. I paid a lot of money to even be, you know, be legit and work at what I do. And you know what? I put the time in, so you guys can at least make the effort to call me an athletic therapist or certified athletic therapist. Or if you don't want to call me a trainer, but you want to say AT, I'm cool with that, because our American counterparts are called athletic trainers. So, as long as you don't call me a trainer, and also, for those in the States, do not call them trainers. They're athletic trainers, okay? They worked hard. Go with it. Go with it. And if you're wondering, why don't we have the same names? It's because the Canadian counterparts kind of wanted a little bit more recognition and to differentiate themselves. So that's why we have athletic therapists. And so in the clinic, we do not touch anything that the physios do, such as, because they're really great at cardiac respiratory neuro. So, you know, COPD, heart attacks, amputees, burn victims, arthritis, childhood congenital disorders, things like that, where, you know, they're going to need that rehab. Physio is amazing at that. They are great. Love them for it. Post a surgery for hip replacements, knee replacements, those guys, they know how to do all of that. Pelvic floor retraining, again, they're great at that. Only time we're ever going to involve being around like a stroke or a heart attack or something like that is because it's happening on a field of play or on site, and we're there and we're first responders. We kind of have to respond to it. So yeah, it's the only time. But anyone who has injuries to muscles, ligaments, tendons, bones, that's what we do. We're like, if you relate us to, say, a sport med doc or doctors, we're like the sport med doc of therapy, and the physio's like the GP, where they have to know like a wide array of stuff. So you want to find the person who's going to address what you need. And so also, because I know some doc friends who don't even realize this, but athletic therapists, guess what? We actually assess for concussions, and we go through the protocol with them, because we're assessing you guys for what's going on and trying to move you along and manipulate your body so you can actually get back to where you need to be and functional, so that the physician can clear you of it. So yeah, you get concussion, come see us. We'll help you out. We'll take you, we'll move you along, because our job is to not have a job. Our job is to have a rotating door. We wanted that someone gets healthy and good and quickly, that, you know, we've got the next person in. So we're always, you know, steady, but good. And, I mean, my patients are awesome. I love them. Same with my athletes. They're great. But you know what? I don't need to see them every day. Okay? And I don't expect you to. It just depends on what are your goals, do you have competition, do you have vacation, what's going on, what are we preparing you for? That is what we're looking at, okay? And so, yeah, anything with muscles, ligaments, tendons, bones, that's us. So yeah, we do massage, but I'm not a massage therapist. We can do things using ultrasound or IFC or muscle stim. Yeah, okay, we can do that, and the physios do that. But again, everyone has their own place and how they apply things, okay? But we also do personal training, but we're not personal trainers, because again, we kind of steal everyone's shtick and kind of combine it together and make it athletic therapy. So anyways, but it works. And so by combining everything all together, you're getting, your injury rehab is a shorter time frame, because you're moving along quicker. We do a lot more hands-on, more one-on-one time, and we educate you, because, you know what, my job is not to have you here every day or every week, okay? Unless it's something that's more severe, and yeah, okay, or just whatever the case. But for the most part, people aren't here all the time. And we want you moving past things, okay? And we're going to educate you and teach you how to recognize things and how to take care of yourself, and to make sure that, you know what, that you can take care of yourself, and only when you do something very kind of silly and that you re-aggravate something that you can't take care of it given what we've given you, then come see us and we'll help fix you up. Okay, so we're very dynamic. We will start looking initially when we assess you for whatever you came in for. So say it's an elbow injury, it may start off with the elbow injury, but then we're going to also look at the full body, like the whole body, because the thing is, yeah, I know it's your elbow, but what else is going on? What else did you end up limiting or compromising because of that area that is injured, and limiting your daily activities and your quality of life, right? So there's a lot more involved. And the other thing is, me personally, I don't like pulling people out of things, and I'll try to keep them as active as I can. So, because part of it is your psyche. We don't want you to feel bummed out because you're not participating, you're not part of the group or your team or your sport or your activity, because when you lose that part of you, it makes it really tough for us to rehab you, because how are you going to be motivated, right? If I take what take away what you enjoy. So again, it's like this whole big spectrum that we look at. It's not just one thing. And there is a reason why I talk passionately about this, because you know what? I have actually gone for athletic therapy. That's how I got into this. My athletic therapist was amazing. I didn't even know it was. And you know, it fixed me up. And I was just like, wow, this is awesome. And it worked. And you know what? This would be kind of cool. They know so much. They're they're so knowledgeable. I could ask any question, they'd have an answer. And it's like, wow, like awesome. I want to be like that. And so I did. And I went through that whole, all those hoops and everything. And you know what? My days are super long and crazy, but I love it because you know what? I thrive on what I get to do. My patients are amazing. They also make sure I'm taken care of. So I'm not just the only one, you know, that's investing in it. It's my patients. So they make it worthwhile to be at work long, crazy hours, and be proud of what I do. And I also get to have experiences where I get to travel the world internationally as a therapist and get to meet so many different people and make friends around the world and have a life that's so unique and so different. And I wouldn't change that. So I really hope you guys learned something from this, and maybe not just go, oh, you just massage, or oh, hey, trainer. And maybe you guys will, you know, say, hey, that's an athletic therapist. And you know what? That would make me smile. And I would really, really appreciate that, because I worked really hard for what I have. And I try to do my best to help my patients feel great. So it's a tough journey, but you know what? I'm glad I'm the person that gets to help people out. So again, hope you guys appreciate and will, you know, maybe call me by the right title, like athletic therapist or AT. Okay, well, you have a great day, guys. Okay, bye.